Burning, urgency, pressure, like classic UTI symptoms, right? But then your tests are coming back negative and you are not imagining things. And I want to talk about something called chemical cystitis and why it can perfectly mimic a UTI and what actually helps prevent it. So let's talk about like what is a chemical cystitis and why it feels like a UTI. So chemical cystitis is a bladder irritation caused by non-infectious triggers. Instead of bacteria, the bladder lining, the urothelium, it gets irritated or inflamed by chemicals or irritants, okay? The bladder nerves don't really care why they're irritated. Infection or irritation can trigger the same symptoms, or they sound like a UTI: burning with urination, urinary urgency, and potentially frequency, abdominal pressure or pelvic discomfort, or you may have gone to the doctors and it's UTI pain with negative cultures. Common triggers that sneak up on people, and this is where it clicks for many patients. They have to think about like what are the triggers, and that's why journaling is so important. Number one is medication. So it can be certain antibiotics, chemo agents, non-steroidals. These are like your ibuprofens, your Advils, or maybe there's like some change in your urine that it's becoming more acidic or dehydration. There's like supplement drinks like vitamin C, coffee, alcohol, energy drinks. Those could be an irritant. Hygienic products like scented soaps, wipes, douches, bubble baths. Another one is post-treatment irritation. So after they finish antibiotics or antifungal, when the bladder lining is already really sensitive, it may be temporary, but the trigger the bladder to stay still reactive and in pain. So consider these as maybe those are the triggers you've been suffering. And really, this is why antibiotics won't help you. If there's no infection, antibiotics won't actually fix chemical cystitis. In fact, they can further irritate the bladder, disrupt the vaginal and gut microbiome, and increase inflammation and nerve sensitivity. This is why people feel stuck in this awful, horrible loop where they have symptoms, they get antibiotics, and then the symptoms return, but it's not treating correctly. Now, how do we prevent chemical cystitis flare? And let's have like practical preventions first. Number one, we have to calm the bladder lining first. Think soothe before you treat. Strategies often include, number one is hydration, drink a ton of good water, avoiding harsh irritants, so any type of coffee, alcohol, and giving the bladder time to reset. We want to identify the chemical triggers. So think about when your symptoms happen: after coffee, after that orange juice, after I shower, and what new supplements or medications did we just start to introduce that could be showing this pattern. Number three, we really want to support your healthy and normal microbiome, because really a healthy vaginal or urinary or gut microbiome helps regulate inflammation and nerve signaling, especially important after we use antibiotics or antifungals. And highlights star this one: avoid unnecessary antibiotics. If cultures are negative and symptoms are persisting, it's time to pause and reassess rather than repeat antibiotics. After a UTI, you may have something called a post-UTI hypersensitivity. So after you had a UTI, true infection, the bladder can stay on high alert even once the bacteria is gone. This is very common and treatable, but needs a different plan than infection. So I want you to sometimes pause and think, this may not be a UTI. I've had repeated negative urine cultures. Symptoms are triggered by something, whether it's food, drinks, medications, hygienic products. I sometimes have improvement, but then I have a rapid return. I'm not having any fever. I'm not having a systemic illnesses. These are all clues and really should not be dismissed. If this sounds familiar to you, hear this clarity. You are not broken. You're not crazy. It's not in your head. Chemical cystitis is real. It's actually pretty common and very often misdiagnosed as another UTI. Prevention is about calming inflammation, protecting the bladder lining, and breaking this horrible antibiotic cycle. If this helped you, like and subscribe. And if you want a deeper dive into post-UTI bladder sensitivity, prevention plans, or want to test versus when to pause, check the links below or book time with our team.